So we're going to talk through some lower extremity arteries that you need to know for class. So with the arteries, we're going to start with the heart and the aorta. That's the largest artery in the body, leaving the heart, and all systemic arteries in the body are going to arise from the aorta. So we can draw the aortic arch. We're going to have the descending thoracic aorta as it travels through the thoracic cavity. It's finally going to get to the descending abdominal aorta. It's going to be traveling just anterior to the vertebral column. And at the end of the abdominal aorta, it's going to bifurcate. So it's going to branch into the left and right common iliac arteries. And we know that anytime we have an artery with the name common, it's going to further divide into other arteries. So we see this is true here as well. So the common iliac artery on each side is going to send a branch internally called the internal iliac artery. And that's going to travel into the bowl of the pelvis, and it's going to supply some of the internal pelvic organs with blood. The common iliac artery is going to continue after it sends off the left and right internal iliac arteries. It's going to continue as the external iliac artery until it travels underneath the inguinal ligament, which is pictured here in purple. So once the external iliac artery travels underneath the inguinal ligament, it's going to change names, and it's now going to become the femoral artery. Now, the femoral artery also is going to give off a branch, and this becomes the deep femoral artery. And it's going to travel deep around the superior aspect of the femur. The femoral artery is going to continue along the length of the femur, and it eventually pierces through the adductor hiatus and travels posterior to the knee. So I'm indicating that here with some dotted lines. We're now behind the knee, and the artery is going to change names. It's going to become the popliteal artery. The popliteal artery is going to branch into the anterior tibial artery, which is shown here. It's going to travel anterior to the tibia, and it makes this kind of circle-like structure on the top of the foot. Okay. And that's called dorsalis pedis. This is a pulse point, so you may assess your patient's pulse on the top of their foot here. The popliteal artery also divides into a posterior tibial artery, which travels along the posterior medial aspect of the tibia, and you can palpate its pulse behind the medial malleolus.